Good afternoon. Good afternoon, and thank you for tuning in. This will be our last COVID press conference of 2020. There's been a lot of them, and thank you all for tuning in week after week, day after day. It's been an enormously difficult year for everybody, and I want to thank you for hanging in there, and I want to thank you for tuning in to keep yourselves informed. It has been a big part of the reason we have been able to be effective in fighting coronavirus. I also want to give a special welcome to Dr. Nicole Alexander-Scott, who is feeling terrific and is out of isolation. Welcome back, good to have you. And also to Director Brett Smiley, who is feeling terrific. He tells me he went running yesterday and he's feeling great and he's out of isolation. So welcome back, it's great to have you guys. Dr. Chan was not able to be with us this afternoon. He's going to be our regular person to update us on the vaccine, but today Dr. Alexander-Scott will go ahead and do that. So as a reminder, no press conference next week. As I said, this is the last COVID press conference of 2020, and then I'll be back here on Thursday, January 7th at 1 o'clock for the first press briefing of 2021. I also want to thank the members of the press who are here. You have next week off, at least from this press conference. You guys have been incredible. You were here every single day when they were 7 days a week, and you've been here every week since then, and I know you got a tough job, so I want to thank you all for being here. I'll try to keep it a bit shorter today. I know it's a holiday season and we're busy, but nonetheless, COVID is with us, so it's important that we stay informed and stay vigilant. Let's begin with the data. Please put the slide up. As we always do, yesterday we had 880 new cases out of 12,000 tests. So that gives us a percent positive of 7.1%. And very sadly, another 8 deaths. My heart goes out to Rhode Islanders who are losing loved ones, especially now, a week before Christmas, a week before the holidays. It's been a brutal year. And so if you have a loved one who has passed, or you have a loved one now who's struggling in the hospital with COVID, our thoughts and prayers are with you, and we're doing everything we can. And God bless. I want to draw your attention to the new data that we're tracking daily, which is the exciting piece of data on that slide, which is the vaccines that we've administered. As of today, 6,400 Rhode Islanders have received their first dose of the COVID-19 vaccine. Obviously, we have a long way to go, but that's exciting. Over 6,000 Rhode Islanders have already received the vaccine. We're vaccinating people every day, every week, every month going forward. And as we look to 2021, we are assured by all the manufacturers of the vaccine that they're going to really start to crank up the manufacturing in January and in February and in March. So we're on our way now. This is the beginning of the end. The vaccine is effective. It is here. And come next year, we're really going to start ramping the vaccinations. Another data point that gives me hope and relief is the percent positive rate. I have a bit of relief looking at that percent positive, that it's going in the right direction. We want to see it at 5% or below. We are not yet at 5% or below, but we've turned the corner. We have turned the corner. A few weeks ago, I was up here and we were flying up the curve, 8, 9, 10% positivity, and now we're coming down. So that is because of the pause. It's also because we're doing more testing and because our contact tracing is getting better and faster. We don't have a backlog anymore. But to those of you who paid really close attention to the pause, which was most people, thank you, it worked. And we're seeing terrific results in saving lives, seeing our hospitalizations plateau, still over full, but plateauing. So it's, it's a significant improvement is what I would say. For the past few days, we're hovering around that 6% test positivity. And that is a very significant improvement from where we were a month ago. and it's a much safer place to be. And so again, thank you. Thank you for hanging in there with the pause and following the rules. It turns out it was the right call, and it's been very effective, and it's just allowed us to stabilize the situation. As I said, we're not out of the woods. We want to get to 5% positivity. We're not there yet. But if we continue to be serious about following the rules, we can continue to stay on this good curve and be in a stable situation. So what that means is, although we've lifted the pause, over the next few weeks, we just need everyone to be careful. We cannot just flip the switch and go back to life as usual. Again, it's a slow dial. So the name of the game for the rest of the year through the holidays is protect your household, stick with your household. Stay with the people you live with. If you want to go out to dinner, fine. Wear your mask, wash your hands, follow the rules, dine with the people you live with. If you want to go shopping, wear your mask, get tested at one of our pop-up centers, go with the people you live with. That's the whole name of the game. Christmas Eve, Christmas Day, New Year's Eve, New Year's Day. Stick with the people you live with, and find other ways to communicate with your loved ones safely, but don't gather indoors with people you don't live with. That's the name of the game, which is hard, but it's effective. And of course, just be vigilant about mask wearing. I have a very specific ask for everybody in Rhode Island. In addition to that, make a plan to get yourself tested twice between now and the end of the year. If you're a person who celebrates Christmas, get yourself tested before Christmas and after Christmas. It's just kind of a good way to think about it. We are really ramping up our testing. At this point, there's no excuse not to get a test. You can go on the portal, portal.ri.gov. We have plenty of capacity in Wickford, here in Providence at the Dunk. Go to Warwick Mall, there's dozens of pop-up sites. Go get tested. It's free, it's painless, it's quick, and you'll know. Because if you're positive, we need you to quickly get into isolation and tell all your people you were near that they need to go get tested. So make a plan, 2 times, everybody, before the end of the year. And as I said, stick with the folks you live with. Dr. Alexander Scott's going to talk more about testing in detail, but I just wanted to give everybody like a simple, concrete, life-saving thing that you can do between now and the end of the year. Since this is our last press conference of 2020, I thought it would be appropriate to give a very brief update of how we have spent our federal CARES Act funds. You will recall that in the thick of the pandemic, Congress took swift action to pass a federal stimulus relief bill. And I want to thank our federal delegation, Senators Reid and Whitehouse, Congressman Cicilline and Langevin. Amazing, all 4 of them in touch with me constantly. I can't thank them enough. In any event, because of their hard work, Congress passed the CARES Act, and Rhode Island received $1.25 billion of critically needed relief. And at this point, we've allocated all of that. And so I thought it would be helpful to take a few minutes to just explain where we've allocated the monies. Obviously, there's an extremely detailed list of how we spent every penny. We have a portal, and we've had numerous hearings before the state legislature. So if you desire great detail, you can go there. But give me a second to take you through how we've invested the $1.25 billion to get through the pandemic. And I'd ask you to please put the slide up that goes through the breakdown. So we spent it in the following big areas. First is to the COVID public health response, first and foremost. Testing, contact tracing, vaccines, et cetera. Second, business and economic support. One of the hardest things about this is we've been dealing with 2 crises at the same time. An economic crisis that has put tens of thousands of Rhode Islanders out of work and small businesses on the brink, and a public health crisis, and often their intention. So we've put money out to business and economic support, individual supports, helping people with food, cash assistance, housing, education support. Big thank you to everybody who's been a part of K-12. Be proud of your work. Rhode Island is setting the pace for how we've kept our kids in school, and we've allocated money to cities and towns for that. And then municipal support and COVID-related state government operations to all the police, firefighters, DOA, public health workers, so many social workers, et cetera. We've used some of our money to meet the immediate needs of the crisis. And it has been a challenge. So again, you can see the information in front of you. I want to focus on two particular areas. The first is the $130 million that we've spent on our direct COVID health response. So that is $23 million in our field hospitals, which we are using right now, $6 million in contact tracing and case investigation, $24 million on PPE, so that's ventilators, N95, gloves, face shields, masks, which we've gotten out to nursing homes, hospitals, the National Guard, $33 million on testing. Rhode Island continues to lead America in testing. $44 million on community mitigation and other direct healthcare responses, particularly in the hardest hit communities, Central Falls, Pawtucket, areas of Providence. We've also spent nearly $500 million on business and economic support. About half of that money went to hospitals to ensure that they could keep their doors open and their employees employed at the height of the crisis when we asked them to shut down and their revenue fell off a cliff. And we also spent more than $125 million in direct support to our local businesses. So and I have Commerce Secretary Pryor with me today, who's been outstanding in his leadership through this crisis, and I want to thank him. The other states in the region call him for advice. That's the Restore RI initiative, Take It Outside, the Pause grants, the art and culture grants, et cetera. We've dedicated, more than 10% of our CARES Act money to helping struggling small businesses. And, here's what I would say. We've spent, a lot of people have been asking me, how do we match up with other states? So we've spent more than 5 times as much as Connecticut per business, and more than 15 times as much as Massachusetts per business. Having said that, I will be the first to say it's not enough. I have been trying to be out and about, shopping local and keeping my ear to the ground, talking to small businesses, restaurants, bookstores. It's brutal, it's tough, I'm sorry. If your survival is the name of the game. But we have tried to use every penny that we could of our CARES Act to help you get through it. I know it's cold comfort to know we've done better than other states, but I hope you'll accept it as evidence that we really care about our small businesses, and we're gonna get through it. 2021 is around the corner, and it's gonna be, let's make it the best yet, particularly next summer. I think we're gonna help you do everything we can to really make up some of the lost revenue from this year. We also set aside $45 million for the Back to Work initiative. You might recall that 6 months ago, I launched a Back to Work job training and job placement initiative using $45 million of our CARES Act. Back to Work was designed specifically to reach out to Rhode Islanders who had lost their job due to COVID and who were at risk of being long-term unemployed. Maybe they're in an industry like retail, like hospitality, that's going to be struggling for a long time. Maybe their skills were a little bit outdated, and so they needed some job training in order to get a different job. So we said we're not going to leave those Rhode Islanders behind. We were going to dig in and be there for the people who had lost their jobs. And we did it with an eye towards equity. We said more than half will be women, about more than 25% will be people of color. And I'm thrilled to announce today that by the end of the year, by the end of next week, we'll be on track to have more than 5,000 Rhode Islanders who are out of work due to COVID, trained, supported, and matched up with a job. That's incredible. That means the Department of Labor and Training, working with Commerce in my office, they've established in just a few months 130 different training programs, and nearly 200 businesses have hired back to work participants. We've also, throughout that, provided help for folks who were getting the training. You can't put your life on hold while you go get trained. So we've provided housing help, rental help, childcare, transportation. I am so proud of the 5,000 people who had the courage and strength and determination to pick yourselves back up, get trained, some of you mid-career, mid-crisis, and get a job. And I'm super proud of my own team. Scott Jensen, who is our Director of Labor and Training, is a miracle worker in my estimation, and he and his team have worked literally every day for months to make this a reality. So I want to say thank you. We're not stopping, by the way. We'll get 5,000 by the end of the year, which is our goal. But the business partners have pledged already up to 7,000 jobs. So at a minimum, we're going to get another 2,000 people placed. But we're going to keep going because it is such a successful program, and people deserve a chance to get trained and get a job. If you're a Rhode Islander out there who is out of work, who's hearing me talk about this, go to the website, backtowork.com. Check it out. It's free. I'm not going to say it's easy because you have to go through the training and you have to graduate, but it's free and it's effective. We promise you, if you graduate from the training, you will get a job. So if that sounds good to you, then go to Back to Work RI and sign up. I want to end in the spirit of the holiday for a few minutes with just some thank yous. If you're one of the lucky ones who hasn't lost your job during the crisis, that doesn't mean you've had an easy time. Pretty much no one is having an easy time. Folks who've lost their jobs are struggling like they never have. But folks who've kept their jobs, many of them, have had to work harder under more stressful circumstances than they ever thought they would ever have to or ever thought that they could. And it's put enormous strain on them, their own health, their families. And I want to pause for a minute to say thank you. I in particular want to thank a lot of the public employees who've had to step up since March. Public employees don't always, you don't know their name, you just hear the state or the city. But they're people too. They're Rhode Islanders, friends, neighbors, working their tail off in the past 8 months to help Rhode Island get by. So I want to, as your governor, say thank you to every single public employee who's pitched in and worked so hard this year. There are so many unsung heroes, and I could be here all day listing them all. Mercifully, I will not do that. But take it from me, there are thousands of unsung heroes. Custodial staff. Every Friday, I work late on Fridays. I leave my office, and there's a crew of custodians waiting on a Friday to go clean my office. With no recognition, they don't expect any, they just do it. And you see all around, custodians in hospitals, in the state hospital, everywhere. It's a really hard job on a good day during COVID, indescribably difficult. The teams at Commerce, they don't get a ton of credit. They have been working endlessly. DBR. Nobody likes it when the inspector shows up at your restaurant, let's be honest. But they've done it. They've done it nights, weekends, 7 days a week with grace, with patience, and with an eye toward helping you out. Not a gotcha attitude, an eye towards let's help you to be in compliance. The staff at DEM, who've been helping Rhode Islanders take it outside. The team at EMA, who had a stockpile of ventilators and masks and who got it out, even when the federal government wasn't there for us. Our team got it done. Our IT team, I've been up here forever talking about crush COVID and the text that you get when you get a positive test or when your test results are ready. That didn't exist. We had to, our IT team had to create that from whole cloth, and they've done it. And they've done a beautiful, beautiful job. To everybody who volunteered their time on weekends and on holidays to keep people safe, we couldn't have gotten through the year without each and every one of you. I would venture to say, before this crisis, the average Rhode Islander probably didn't spend a lot of time thinking about the Department of Health or their work. A lot of people have said to me, I didn't even know the state had a health lab. Well, we do. By the way, it's not in great condition and we need to invest to rebuild it. But I want to do a few shout outs. Adam Miller and Christopher Harmon, they've been working there for years in the state health lab. We didn't maybe know that, but they've been there. Their lab, they are two of our lab supervisors at the state health lab, and they were some of the first state employees to serve on the front lines in this crisis in February when we didn't know what was coming at us. Adam, Christopher, Dr. King, all the folks at the health lab have risen to the challenge over and over and over again, providing us timely and accurate test results. So I want to say thank you. I want to say thank you to Imelda Benitez. Thank you, Imelda. Imelda spent hours. She works at DLT. As you can imagine, Department of Labor and Training has been totally overrun. At our peak, we had 200,000 unemployment insurance claims. She's been a dedicated employee. She told us the story of, she spent hours on her own, not because anyone made her or told her, helping a caller who was having issues with her computer. So thank you for going above and beyond. She knew the person on the other end of the line was stressed out of a job, and who hasn't struggled with an old computer and broadband? And so Imelda took the time to hang on the phone for a couple of hours so that person could get their unemployment check. I have to thank Mike Manning from the Rhode Island National Guard, who stepped up to create and lead our command center for K-12 education. I want to thank Major Katie Tracy, also, who has been in the command center and who's overseen the purchase and distribution of more than 6,000 air purifiers that we are putting out all across the state in classrooms to keep our kids and teachers safe. When I went to them and said, guys, we're going to do a command center, no one knew what that meant. No one knew how we would do that, but they did it and they figured it out. It's fantastic, and it's operated 7 days a week since the summer, and it has kept thousands of children in school and given them a chance. So I want to thank you. I also have to say a special thank you to the folks at DCYF. I talked yesterday to Kevin Aucoin, who's doing a marvelous job running DCYF. You know, look, DCYF deals with the most challenging situations in Rhode Island on a daily basis, on a good year. The holidays are a stressful time for a lot of families in the state's care on a good year. Now add COVID to that. Add the fear of social workers who've had to go into homes throughout the crisis. Add the fear, anxiety, and financial distress that's happening in the community that the vulnerable families of Rhode Island bear the most. I wish I could thank each and every one of you. You've done an extraordinary job, but perhaps no employee has driven the mission more than Betsy Aubin. Betsy's been a key leader at the DCYF's peer support team, which is a vital mental health resource for DCYF staff who are in need of support. And she's also spearheading race equity training for the department. That's pretty incredible. You know, the social workers and caseworkers and lawyers at DCYF are there for the kids, but they need support too. So I want to thank you, and I especially want to thank Betsy for being there for our own team. I could go on and on, as I've said. There are thousands of unsung heroes, and I just want to say thank you to each and every one of them. And I suppose I want to drive home the point to Rhode Islanders that this has been a brutal time for everybody, but those who have been lucky enough to keep their job have had a tough go of it too. And so on behalf of Rhode Island, to all public employees, state and cities, I want to say thank you. So finally, I'll just wish everybody a happy holiday. I will say it's a different time of year. It's a different kind of Christmas, different kind of Hanukkah, different kind of Kwanzaa, different kind of New Year's. It feels a little bit lonely. It feels, you know, not like anything we planned, not like anything we really would want. But I would say, you know, when we, you know, my family and I celebrate Christmas, it's about loving. It's about finding the light in the darkness. It's about holding on to hope. And it's about taking care of others in need. And that's all alive and well in Rhode Island. We did it, Rhode Island. We made it to the end of the year. And by the way, we're in a stable place right now. Millions of times over the last year, Rhode Islanders have come together, pitched in, made donations, looked in on a neighbor, helped somebody get food in quarantine. We have found the light in the darkness. We have found the space in our lives, and we have dug deep to figure out a way to care for others even when we've been struggling. So my wish for all of you is a very happy holiday. Yes, it's different. Yes, you're going to have to innovate. Yes, you might have to Zoom instead of seeing somebody. Yes, you might have to go visit and wave from outside. But it is a holiday nonetheless. And I just want to thank you all for giving me your support this year. I want to wish you a very, very happy holiday. And in my family, we know it's going to be different, but we're excited. We're going to make the best of it. We're going to have a good time. And we are really looking forward to a healthy, prosperous, safe 2021. So with that, I'm going to turn it over to Dr. Alexander Scott, and then we'll come back for your questions.
Thank you, Governor. Hello, everyone. It's great to be back with you, along with my colleague, Director Smiley. Before getting going, I also want to say thank you. I received well wishes from many people after testing positive almost 2 weeks ago. Thankfully, I never experienced any symptoms, and by getting tested regularly now and going forward, I was able to effectively protect my household. I was able to identify that I was positive and ensure that no one else around me has tested positive since then because of that level of information we were able to have. So I was very touched by everyone's kind thoughts and want to express appreciation. So to jump in, I want to hit on 3 main topics. These are the tools that are going to take us through to the end of this pandemic: vaccinations and testing and treatment. We're continuing to do very well on the vaccination front. As people probably saw in the news, the FDA has authorized the use of COVID-19 vaccine developed by the company Moderna. This was after doing the same extensive weeks-long review of all the safety and efficacy data on the Moderna vaccine that was done on the Pfizer vaccine. What was involved includes reviewing thousands and thousands of pages of technical data on the vaccine's clinical trials and on the manufacturing process for the vaccine. There were no safety concerns identified, and the data are indicating that the Moderna vaccine, like the Pfizer vaccine, is remarkably effective. It has a 95% effectiveness rate, which is incredible for a vaccine. Thankfully, also, we have an expert panel in our Rhode Island COVID-19 vaccine subcommittee. I want to say thank you to all of them for their commitment emergency meetings, reviewing the data, asking good questions, really making sure that we're doing what's right for Rhode Islanders. That subcommittee has determined that the safety review at the federal level was sound and recommended that we use this vaccine, the Moderna one, in addition to the Pfizer vaccine. We expect 19,000 doses of Moderna vaccine to come into Rhode Island this week. 11,700 doses are coming into Rhode Island just today alone, which is very exciting. And by the end of the week, 35,000 doses should have come into Rhode Island from both Pfizer and Moderna. That includes roughly 5,000 doses set aside for vaccinating in our nursing homes, which is scheduled to begin just after Christmas. All through next week, when we're doing a lot of vaccinating in nursing homes, we expect our doses administered numbers to rise quickly. As of 9 a.m. this morning, as the governor shared, 6,400 first doses of COVID-19 vaccine have been administered in Rhode Island. We are in the last stages of finalizing our COVID-19 vaccination scheme. We shared the early form of it a couple of weeks ago. It's not going to change from that high level view, but we're getting to the level of detail that we have in Rhode Island in terms of how we're going to distribute it so we can continue to be as effective as possible. And we'll lay out the order in which vaccine will be available to different groups in Rhode Island in the coming days. While we're making some final determinations about some very specific groups, as I mentioned, generally people won't be surprised by the final plan. We've described our approach in broad strokes, explaining that Rhode Island will be vaccinating people based on their risk level, and we will continue to maintain a focus on equity. That's why, as Dr. Chan said last week, we are finalizing plans to vaccinate in Central Falls early on in the vaccination campaign, and we'll move on to the other zip codes and communities that are hardest hit as well. Even within our hospitals where vaccinating is happening now, our expectation is that equity will be the guiding principle. One last note to say about vaccinations is we have not seen anything of concern locally, but there have been warnings about scams issued in other parts of the country. So we want to make sure that you're aware of that. No one will have to pay for vaccine out of pocket, and there is no list to get on to get vaccinated. If someone contacts you asking for financial information related to COVID vaccine, do not provide it. Okay, so the next topic I want to address is testing and treatment. Both of those go together in a package. Dr. McDonald shared last week, as physicians, when you look at tests, you want to be able to do something with it. What information are we going to take from that so that we can handle things differently? And we want to make sure that everyone knows about the treatment options that are available. We're ramping up testing. We want to ramp up the treatment access to that at the same time. To start with the testing, as the governor's been sharing, we really want people to be tested. Testing is how we can get people to understand or know if they are positive, particularly if they don't have symptoms. I'm now the poster child for being able to do that, so that then you can make the changes you need to effectively protect your household. Stay in isolation, keep other people from receiving invisible spread of COVID-19. Testing is an excellent tool to be able to do that. We really want to encourage everyone to not only do testing, whether or not you have symptoms now, that's what we've expanded to. Even if you do not have symptoms, you should get tested, and also get tested regularly. You can do it up to every week, going and getting tested to get into that rhythm. That's a major tool to be able to protect the people in your household. To that end, we saw a lot of demand at the testing pop-up sites that we've held over the last few days. We've said we're going to take those steps to reach you where you are, and people are responding. I want to take a moment to clarify what these sites are for and what they're not for. Pop-up testing sites are about meeting people where they are. For example, if someone is already at the Warwick Mall, we want them to be able to get tested there. If someone is visiting another area, we want you to be able to have testing accessible to you while you are already there. If you're at Chapel View shopping already and have a few extra minutes to get tested, go do that. However, pop-up testing sites are not intended to be places where people should be going specifically to get tested. We already have tons of resources in places for that. If your sole aim is to go get tested, which is what we want everyone to do on a regular basis, the best thing to do is to make an appointment through portal.ri.gov. The team has worked extremely hard to make that accessible, to make it easy. There was a time when you needed to wait days if you wanted to get tested through portal.ri.gov. It's important to know that's not the case anymore. This is a way to avoid long lines for waiting. You can just go on to the portal, schedule your test, know where you'll go in, get the test, and get out. We have invested an enormous amount of energy into building out our testing infrastructure. We have same-day appointments available every day at sites all throughout Rhode Island. You log in, you submit some information, then head to a testing site near you later that day, and you're in and you're out very quickly. No waiting, no lines, and no costs. It's free. Please take advantage of this. Going through portal.ri.gov is the fastest, easiest, most convenient way to get tested. And we want to continue to encourage that. This is a key tool to protecting your household the same way I did. At some of our sites, such as the Dunkin' Donuts Center, you'll have your result before you leave in 15 minutes. We have thousands of slots at the Dunk every day, and there is free parking in the North Garage. We want to continue to expand and make that accessible to you. We want to make sure that you take advantage of it. When you think about the fact that COVID-19 spreads very easily, and when you think about the fact that some people are very vulnerable to this virus, it's pretty clear that getting tested and then being able to change your behavior if you're positive by going into isolation, protecting your household, keeping other people from getting infected, you then have the power to save a life, particularly if you don't have symptoms and don't know that you're positive and there's risk for invisible spread happening to someone who could be at risk of a challenge because they develop symptoms or have underlying illness or they're a senior. Let's take that power into your own hands to save a life. Getting tested helps protect your household, your colleagues, your friends, the people that you love. We talk a lot about protecting your household. Getting tested regularly is that concrete way to do it. In addition to protecting your household, getting tested regularly can help you when it comes to COVID-19. That gets into the second part of what goes along with testing, treatment. Last week, Dr. McDonald talked about something called monoclonal antibodies. This is a treatment for COVID-19 that you get via an intravenous infusion. It's quick, it takes about an hour, and it is very effective. The whole goal is to keep people out of the hospital. It's intended before you even have to go into the hospital. People are describing it as miraculous. In order to keep people out of the hospital, you need to start this treatment early on in the course of your illness. It's not as effective if you started a long time after you've been exposed and have been identified as positive. Getting tested regularly and knowing early on if you are positive is a way to make sure that this treatment can be an option for you. We're working hard to make sure that the treatment is available in as many different places as possible, in nursing homes. We want to build it out at testing sites. We have providers who are ready to work with you to get connected to treatment. please look into that. It is an option that's available for you. So the three things I've talked about today, vaccinations, regular testing, and treatment, are the tools that will see us through to the end of this pandemic. These are the key ways that we are able to protect our household as we get through the rest of this pandemic. If we can stay vigilant and stay focused on the things that will have the greatest impact, vaccinations, testing, treatment, wearing your mask, staying with your household, keeping them protected, that's what's going to get us through this as quickly and as safely as possible. Before finishing and opening up for questions, I want to echo some of the gratitude that the governor expressed. It's hard to put into words the amount of appreciation that you can have being connected to such a large group of people who are committed and working so hard to make sure that Rhode Islanders are cared for. The governor mentioned Adam and Christopher at RIDO's State Health Laboratories and so many other individuals at our other state agencies. These are just a few examples of the dozens and hundreds of people throughout public service who have been doing heroic work. The sacrifices people have been making have been tremendous. I am truly humbled and honored every day to be a part of our entire statewide response team and a proud member of our Rhode Island Department of Health as well. I also know that everyone throughout Rhode Island has been making tremendous sacrifices over these last 9 months. We all know that this has not been easy. It's probably an understatement. For many of you, it's been the most challenging year of your life. I want to echo what has been stated in truly thanking you for your patience and your partnership and your commitment to protecting those around you and those that you love. I'd like to wish a Merry Christmas and a Happy Kwanzaa to everyone who celebrates, and I hope everyone had a Happy Hanukkah if you celebrated Hanukkah as well. Please remember, keep any gatherings just to the people you live with. Pick up the phone or connect virtually to share your love and your gratitude and your warmth this year. And please remember those people who, for one reason or another, might be feeling a little more alone this year. I wish you all health, happiness, and blessings in the month and years to come. And with that, we will open up for questions.
Dr. For you and Director Smiley, from a personal standpoint, how nerve-wracking was it to go through the quarantine and the threat hanging over your head of possible infection?
It wasn't necessarily nerve-wracking. It's definitely equipping, so to speak, to have the information and know this is what we may need to be prepared for. This is the behavior change that I need to be able to make. When you're testing regularly, you're anticipating that that information will come, and it allows us to be prepared to talk about what we're going to do and do the things that are needed to make sure that our household's protected.
No worries on your part?
I mean, of course, you're hoping that you do well in getting through the symptoms, but I was very thankful to know that both of us did well in that regard.
Doctor, how concerned should we be about the new variant in the UK? And for the governor, do you think the US should put new travel restrictions, as several other countries have done on the UK because of this new COVID variant?
Yeah. One of the keys that's important with this new variant is the tools that I just talked about today still work. So we know we can continue to get tested, treatment, the vaccine works against it. Wearing your mask is still most effective. It doesn't change any of the action steps that we can take to do it. We are working closely with CDC, had a call yesterday. Our neighboring states as well are continuing to communicate so that we can understand what variants we have here, whether or not it's here or not, and anything to do differently. But the response to it stays the same.
And Governor, travel restrictions, other countries have done so. Do you think the federal government should follow suit?
You know, I agree with the doctor. I'm not inclined to do that at the moment for Rhode Island. I think that everything that we are doing with mask wearing, distancing, et cetera, ought to be effective. But we're in touch with the CDC, and we'll follow their lead if they direct differently.
In regards to the new COVID relief, I know it's still new, but any word as to how much Rhode Island may be getting?
We are still trying to figure that out. Do you want to? We are literally, the president hasn't even signed it yet, and we are in the process of digging through it. We know we will get some money for testing. We know we'll get some money from vaccines. We know we'll get some money for K through 12, which is fantastic. The exact amount we don't yet know. We haven't figured out, and the exact amount per category we haven't figured out. The thing about which I am maybe most excited is that rental assistance. So there's, it looks to be like there will be a substantial amount of money for Rhode Island for rental assistance, which we are, desperately in need for.
I would add one point on the rental assistance questions. The CDC eviction moratorium has also been extended to January 31st now, which is a terrific benefit to Rhode Islanders who are facing eviction. To set everyone's expectations, it'll be a week or two before we really know, and maybe longer in certain categories. My team will be working through the holiday to understand the Rhode Island impact. But as we learned last time, there's also the potential that there'll need to be new guidance, new rules written. So some of these things could be many weeks before we know exactly how it will apply. But it's good news. There will be additional help on the way. We hope that this is one of several future stimuluses, because we know the need will outmatch what's provided, but it's a step in the right direction, and we're very grateful to our federal delegation for the work.
Nothing in the package for government operations.
There is nothing for revenue replacement or state or local aid. That's correct. There was certainly funding provided for things that we have budgeted and planned to fund, which will be a benefit to Rhode Island and to our response, but there is no direct state or local aid.
What's that going to mean?
It's a little too soon to tell. Another couple of weeks, we'll be able to get a more accurate assessment of what's going to actually flow through to Rhode Island. But after the new year, we should have pretty good numbers to that, and we'll be able to give updates to that effect.
Going back to the $1.25 billion that you detailed, and the business support, I know you pointed out that Rhode Island has dedicated a higher percentage than the surrounding states, I assume, because you've heard the criticism from the small businesses that they want a greater share. Can you just detail why so much of it went to the hospitals, more than half of that $488 million to business and economic support, and $125 million to those businesses when they think they should get more, and kind of how that was formulated and why they couldn't get more?
Yeah. Okay. So you'll recall that in March, April, May, when we were new with this and struggling, we essentially went to the hospitals and said, stop your operations, no more elective surgery, no more non-critical surgery. And so as a result, their revenue had very little incoming revenue. And we can't afford for our hospitals in the middle of a public health crisis to go out of business. Also, they are our two biggest employers. Lifespan, I think, is the biggest employer in Rhode Island. It's a balance. I wish I had more, like Director Smiley just said. I hope the federal government does more, because Rhode Island's economy needs more, as does, I think, the rest of the country. But it was just a balance. We had to keep our hospitals open, functioning, and financially viable. I'm sure if you ask the hospitals if they got enough, they would say no. But we did the best we could to keep their doors open. And then we did the best we could to make up for lost revenue for small businesses.
Governor Raimondo, as you're aware, just outside prior to this week's press conference, the Rhode Island Coalition of Wedding and Event Professionals held what I call an informational picket line. It was quite provocative. Their concerns and needs are, in one way, very similar to just about any industry in the state, yet they're also very unique. They are a significant driver of tourism, and at the same time, because of the going forward nature of deposits and how their business is structured, they are bleeding in one case, more so than anyone, because of the air of uncertainty surrounding when they'll be open for business, and then the projected lead time necessary for them to even be booked. Their concerns are, number one, that a number of them have yet to receive any of the pause money, but they're also asking for an in-person meeting, as well as either a date certain when they can resume, if you will, uninterrupted business, or at least a set of objectives that can be met so that they can inject a degree of certainty into their operations.
Yeah.
What would you or Secretary Pryor have to say to that?
Yeah, I'll offer overview and then Stefan can offer some details. So first of all, I hear where they're coming from. You are correct in that these businesses, certain businesses have been disproportionately crushed in COVID, not just in Rhode Island, commercial real estate, hospitality, wedding planners. It's the nature of it. Airlines, we don't have any airlines here, but you're correct that they've borne the brunt of it. That's why, unlike really, I think, any other state or most states, we made our direct relief available to individual sole proprietors who do. Having said all of, as it relates to a date certain, I can't give that. I really wish I could, but I cannot give a date certain. Right now, the slide you saw, this is a good looking slide, which is to say, this is where we were a few weeks ago, and this is where we are now. I can't even think about relaxing regulations until we get to that 5% and until we vaccinate some more people. So I wish I could give a date certain, I can't. I will say that it is my belief, based on everything I know now, that by, late winter, early spring, we're just gonna be in a much different place in terms of our stabilization and how many people will be vaccinated. The last thing I'll say is, this is a national crisis. I mentioned airlines, hotels, and I do hope, I think some of this stimulus that we're about to get, we're going to be able to use to help these businesses. And I can promise them I'm going to be as creative as possible to find every penny that I can to get out the door to them. And I hope the federal government does something else, because it's going to be a long recovery for these businesses.
Just to underscore what the governor said about the pause grant program, we are pleased that the governor specifically included event professionals in the program. Over 1,500 checks have now been mailed out or deposits made. Over $35 million worth of pause grants have gone out. And event professionals, including event planners, wedding planners, including photographers and videographers, including makeup artists and beyond, were included in that program. So Rhode Island stands out among states that have, in the midst of those restrictions, nonetheless found the way to provide resources to these event professionals. That said, I'm right with the governor that it isn't enough. We have to do more. Within the past 2 weeks, as to your question about meeting with event professionals, I've met with the organizers of the event professional dialogue and advocacy. Within the past 2 weeks personally, I've met with them, and I'm actually meeting with them again this week if there's a scheduled meeting with them, and my team has met with them earlier this week. We're continuing to brainstorm in anticipation of the time when larger events are possible. I will say the governor and Dr. Alexander Scott were very kind and thoughtful in allowing for events to proceed post-pause, up to 15 people with pre-scheduled weddings also permitted to proceed. Those are very small. Those are catered events only with specific guidelines. But in the midst of the public health crisis that we continue to be in, it's great. The last thing I'll say is we need to work towards better. That's only a start, even with the financial relief. So one tool is testing. Both the governor and Dr. Alexander Scott have emphasized this. One of the things that we're starting to do in the pop-up testing context is look to individual establishments and individual businesses. And one idea that the event professionals have brought forward is that we'd like to pilot doing testing at a catered event to see if that is something that we can accomplish on the spot. and whether that will give us greater confidence in the future to open up even more.
Okay, follow up, sir. Are there still checks in process for
Yes.
these people?
Yes.
Is there a date certain, if you will, when they will receive those? And is one last question, is the state considering, and this is, would it be projected across all industries, the relaxation or at least the temporary elimination of filing fees, licensing fees for industries that literally need to continue licensing but aren't allowed to operate legally?
I'd say on financial relief for small businesses, we're looking at an array of options, and it would be too soon to say what options are available going forward. But on the question of the additional checks, we have over 2,000 applications for the pause grants, and the remainder of the checks will be sent out. Of course, there'll be a substantial additional mailing of checks on Monday the 28th.
Governor, you said.
I would be open to that. I don't know. I'm not saying yes. We'd have to work with the legislature. It'll cost money. But I want to be clear that next year is a year of rebuilding, right? 2021 is a year of rebuilding. And I think, like I said before, we need to be as creative as possible, whether that's, relaxing permitting so they can keep doing things outside even after COVID, whether that's licensing fee forgiveness, et cetera. These are all ideas that I'm very open to, because we have to help try to get back on their feet and try to make up for next year some of what they lost this year.
Governor, how concerned are you? You sounded very upbeat today. We've turned a corner. You credited the pause. As you say that, Governor Baker is now imposing more restrictions for the 2 weeks after Christmas. They're somewhat similar to what you have in place now, but how concerned are you that the 2 weeks after Christmas are going to be a problem, just like after the other holidays, and that the numbers could just turn right around, as some medical experts have warned?
So look, I live concerned. I'm going to be concerned until we're all vaccinated and we're fully out of the woods. So to say that I am light about this, I would not agree with, but I have some relief because, as I said, this is a good picture, right? This is a good picture. Now, Governor Baker chose, and by the way, I am not criticizing him because he's doing a great job running his state, and this is brutal to make these decisions. He chose to wait a little bit to hit the pause button. I bit the bullet and paused early. And as a result, we're seeing some pretty good results. So we've also massively ramped up our testing. So am I concerned? Yes. We still have a lot of restrictions in place. There's still pretty serious restrictions in restaurants, pretty serious restrictions everywhere. So I like our chances. People listen to the pause. If they listen to the regulations, we're going to be fine. If everyone goes out and has a big Christmas Eve dinner and Christmas Day, then we're going to be in trouble, and I'll be having to pause again.
Just to follow, do you think much of the pause, as credit for the pause, is because you restricted the businesses, or because it was the message about how serious it is by doing that? And would you have to go back to more restrictions?
Yeah.
Weigh that balance.
So great question. Both. I bet definitely both. It was a seriousness of message. People got the message, but it's both. I mean, it's a fact. If I didn't bore you guys with all the details of all the data, but mobility is way down. Like when you can't go out to a bar or you can't go out to wherever, there's less reasons to leave, less reasons to congregate. If the curfew, if restaurants close at 10 or 10:30, mobility goes down and the cases look better. And also, it was the seriousness. Listen, I won't hesitate to go back to a pause if I need to. We cannot overwhelm our hospital system. Right now, our hospitalizations we have stabilized. If we can stay stabilized, then we won't pause. I don't want to pause. Like, I'm not standing here planning to pause in the weeks after Christmas. If we get to the beginning or middle of January, it looks like nobody followed the rules over Christmas, then I'll have to pause.
Governor, a couple of questions. One, concerning the pause in the hospitals. At this point, what sort of census do you have at the field hospitals Are you seeing that declining? Is there an opportunity maybe even to close one of them? And the second question actually involves a situation that happened yesterday. It was funeral arrangements for Russell Freeman at St. Kevin Church. And at that event in Warwick, I would estimate that there were at least 150 law enforcement officers showing their respect, which raises the question on the part of other funeral directors. What is the message here? Because they are faced with telling families, we have to restrict the number of people, and here the rules seem to be bent.
Yeah. Do you know how many are in the field hospitals? Yeah, I need to get you the exact number, John, of the number of people in the field hospitals. The hospitalizations are not declining. That I can tell you. You know, they're going up. They're just not going up at as rapid of a rate as they were going up. There's no world in which I see closing a field hospital anytime soon. You know, like Brian just said, we're bracing for the holidays. I'm optimistic. People got the memo with the pause, and they're going to continue to take it easy over the holidays. But if they don't, the hospitals will be filled right back up again come January. So we have them. I want to give a lot of credit to Lifespan and Care New England and all those doctors. They're doing well. They're doing really well at the field hospitals. They're high quality field hospitals, and we're going to keep them open. We're going to hope not to use them too much. The reality is we're going to have patients in there for a while. And so I'm happy we have them. That was it on that? And then on the funeral, yeah. I didn't, you know, I was in the car procession. I wasn't actually at the funeral. I did speak to the widow a week ago, who is understandably devastated. By the way, that was our first state employee that we lost to COVID. You know, we ask them, as we ask everyone, to follow all the rules. I don't know that they didn't follow the rules. And I would just say, first of all, my heart goes out to that family, as my heart goes out to all families. And secondly, yeah, I mean, listen, it's the same thing I've said about myself. We all got to follow the same rules, and we can't excuse anyone to break the rules.
Dr. Nicole, Alexander Scott, I have a question about the vaccine. You mentioned that you'll prioritize hardest hit zip codes, Central Falls among them. Do you know what phase that will fall in?
In the first phase.
Dr. On the phasing, the CDC's advisory committee said over the weekend recommended that the next phase should be people over 75 and frontline essential workers. As the state sort of formalizes its phasing, is it going to follow that?
We are taking a few, extra day or two to assess what CDC has recommended and balance it against what we had and the direction we were going in. I feel very strong about what we had in place. Our subcommittee vaccine advisory group has endorsed it and supported that. We'll see if there are any specific changes that need to be made and then make a decision from there.
I guess the big difference was they said rather than just people over a certain age living in congregated settings, they said 75 and above, really no ifs, ands, or buts about it, just because of the high proportion of deaths in that community for people who are older.
Right. Some of the things, for example, that we're assessing is the ACIP guidance where they just gave the first few groups. How does that align in timing with ours? Because we do have seniors of any age early on in the second phase. So the timing may be aligned. We want to make sure that we continue to be thoughtful in how we're doing it, making sure seniors that are at highest risk, seniors that are in long-term care facilities, the home health aides who are taking care of seniors are all vaccinated early. And then we'll make any final determinations about any adjustments to make, but we feel pretty strong about the thoughtful approach we have in place now.
Doctor, do you see CVS and Walgreens administering the vaccine in the weeks to come?
As part of the nursing home program.
nursing home, when it gets to.
Oh, just overall, we have all partnerships on the table. Once we get to the subsequent phases where we need to vaccinate as many people as possible, we want to be as creative as we can, and absolutely pharmacies that are valuable partners like CVS and Walgreens will be a part of that approach.
Thanks, everyone.